it is irresponsible for a young person to go into pediatrics today, knowing that their salary will be $200,000, while they could be any other specialty in there in 350. And so that's over 30 years, $4.5 million of earnings that they're leaving on the table that they could use to feed their families.
You're
These are
absolutely
not,
right.
these are not dumb people. And that's not what George will say. Oh, manual labor is hard. Look, I got no calluses in my
I
hands.
don't.
But people like you and Jazz and I are smart enough that we could go into another field and not do manual labor. And these young people are incredibly smart. That's why you're seeing them say, I'm not even going to do a residency. I'm going to get my MBA and go work for a consulting firm,
Yeah.
right? Because they're not dumb. They are not going to be doing my lawn. They're going to go work where they are attracted to a good income that allows their families to have a good life.
But the difference is I've met a lot of physicians who completed residency or completed just medical school and they ended up doing the technology route or the business route, the administration route, when they don't even have any experience really. Somebody picks them up. So they become what's called an entrepreneur. All right. There's no security. Today you get paid a lot of money. Tomorrow you're not there anymore. Then you got to reinvent yourself, find another job, build it up. You stay there for another year or two, goodbye, move on to somewhere else. You know what? I've seen it all from 96 until today. We rode 2000 crisis, we rode 2008 crisis, we rode the COVID crisis. The doctors just continue to, they're like this. They're
That's not true,
they're
George.
stable.
No, it's not stable, George, especially not in pediatrics. The starting salary for a pediatrician in Northern Virginia has been around 160 for the last 15 years.
Right,
Inflation has grown tremendously. You
right.
cannot live in my neighborhood and make $160,000 a year.
Yeah.
It's just not possible.
Mhm.
And when you say it's stable, you're
The
discounting
job is
your,
stable.
well, it's not stable because you can't pay your bills when inflation keeps rising and your salary
It
doesn't
should go
go
up.
up.
Yes, it should go up.
So
You should so go
so
up two
it's
more.
not stable.
You're right there. And you mentioned the market, and the market determines what the sports figures and the concert people and everybody gets paid. And so, what is that market saying about pediatrics and the value of pediatric care? But it's not just the market. And I use Medicare, even though pediatricians don't deal with Medicare, but I use Medicare as an example. We have been operating for many years in Medicare under budget neutrality, that when something gets paid more under Medicare, something has to get paid less. There is no other field where, because of population growth, because of technology growth, because of disease or acuity of the work, whatever it may be, there is no other field where the total amount spent is arbitrarily capped so that it cannot go up by this concept of budget neutrality. In fact, it's not stable. We're being forced to do more with the same amount, which translates because of inflation to doing more with less. So we talk about a free market system here, but medicine is anything but a free market system. And it's wonderful to think that capitalism will win, but it does not seem to do that in medicine. The laws of economics 101, the supply and demand curve, don't seem to work in medicine the way they work in every other field. And that is the reason that the government has to put these caps on, because it could explode exponentially. But at the same time, it is not conducive to attracting the best workforce and giving them the tools they need to provide the best care for every single patient. And I think that's the situation we find ourselves in, particularly now in pediatrics, but across the entire house of medicine.
And just it's not just the pediatrician, right? If I'm not making enough money, I can't hire a good LPN or a good 2-year RN to help me with my patients. If the dietitian is not making enough money, she can no longer see my referrals. If the speech therapist is not making enough money, she can't see the kids. If the talk therapist is not making enough money, she'll go all cash. And the whole system is crumbling. It's not just we're not paying the pediatrician enough. We're not paying all these expert clinicians that support my job what they need to be paid to be comfortable and be able to see the kids in a timely basis.